Welcome to Health Bulletin. Today's bulletin is full of important updates, including a close call during an organ donation in the US, to groundbreaking climate solutions and alarming updates from the global fight against Mpox. Imagine this. A man declared brain dead, already prepped for organ donation, wakes up moments before his organs were set to be harvested. This happened in Kentucky, USA, where Anthony Thomas T.J. Hoover Dick, who was declared brain dead after a drug overdose, shocked his family and hospital staff by opening his eyes during his honor walk. The organ donation was immediately cancelled, but this incident raises serious concerns about the protocols used by US hospitals to qualify brain death. Hoover's case has become the focal point of a congressional investigation into organ procurement, and it's sparking a much-needed conversation. Just how foolproof are these systems? And what does this mean for families who trust medical professionals with such life-altering decisions? In Uganda, the Ministry of Health has confirmed its first death from Mpox, as the total number of confirmed cases rises to 164. The death was reported in the Masindi district, adding to the growing concerns across Africa. Mpox, formerly known as monkeypox, has been declared a global health emergency by the World Health Organization. While the virus primarily spreads through close contact, including sexual transmission, it has now spread to 18 African countries, with over 1,000 deaths reported in the continent this year alone. The question we need to ask is, why does Africa continue to bear the brunt of these outbreaks while the rest of the world struggles to provide the necessary resources? Meanwhile, in Germany, health officials have confirmed a new, more infectious variant of Mpox clade 1. The Robert Koch Institute revealed that the patient was infected abroad, but further details remain unclear. The variant was first detected outside Africa, in Sweden and Thailand earlier this year. As global health authorities scramble to contain these outbreaks, this new variant may spread even faster, raising alarms about our readiness to deal with such rapidly evolving viruses. Are we truly prepared for what's coming next, or are we simply reacting too late? Finally, to China, where scientists have achieved a breakthrough that could one day redefine how we treat brain damage. Researchers in Guangzhou successfully restarted a pig's brain an hour after it was removed from the body. Using a life support system, they restored neural activity, offering hope that similar techniques could one day resuscitate human patients after heart attacks. This could be a game changer in the field of medicine, especially for cardiac arrest victims. But with such groundbreaking research comes ethical concerns. Just how far are we willing to push the boundaries of life and mortality? And are we ready for the moral questions that follow such advancements? Now we move from the human body to the health of the planet. Could we cool Earth by injecting diamond dust into the atmosphere? Sounds like science fiction, doesn't it? But a new study published this month in Geophysical Research Letters, scientists report that shooting 5 million tons of diamond dust into the stratosphere each year could cool the planet by 1.6 was enough to stave off the worst consequences of global warming. The scheme wouldn't be cheap, however. Experts estimate it would cost nearly $200 trillion over the remainder of this century. The idea takes its inspiration from a natural process, volcanism. Throughout history, eruptions have vaulted millions of tons of sulfur dioxide into the stratosphere. There, the gas reacts with water vapor and other gases to form sulfate aerosol suspended particles that reflect sunlight back into space. The effect can be substantial. The 1991 eruption of Mount Pinatubo cooled the planet by as much as 0.5 OC for several years, for example. Sure, it would take decades of continuous injections and cost billions, but the concept is gaining attention. Whether or not this is practical is up for debate. But one thing is clear: we are running out of time, and the options to counter climate disaster are becoming more extreme. So is this the future of climate action or just a desperate gamble? So, from a man waking up moments before his organs were harvested to scientists working on restarting brain function, what we're seeing is a world in rapid change. Whether it's climate solutions or cutting-edge medicine, humanity is pushing the limits of what's possible. But with every breakthrough, new challenges arise. The real question is, are we prepared to handle both the opportunities and the risks that come with these advancements? And more importantly, what does all this mean for the future of our watching Health Bulletin? Make sure to subscribe for more insights in science and health that's shaping our world. Until next time, stay curious and stay informed.